so I'm going to walk into the patient's room. I'm going to close privacy. I'm verbalizing hand hygiene. Hi, my name is Kayla. I'm going to be your student nurse today. Can you verify your name and date of birth? Okay, I'm going to check your wristband. Okay, do you have any allergies, especially to latex or betadine? Okay, good. Today I'm going to be inserting an IV. And I'm just going to look at your hand. Do you have any preference of what arm you'd like it on? Okay, great. So I'm just going to go ahead and get my my equipment prepared, if that's okay with you. Just going to put this underneath your arm. Okay. I'm going to get my equipment ready. I have a 22 gauge cannula. I have my 10 milliliter syringe already pre-filled with normal saline, and I have alcohol, and I have my tourniquet, gauze, my tape, and my tegaderm. I have my extension set, and I have my my tube to the IV, which is what I'm going to prime right now. So I'm going to, and I have my solution. I have 0.9% sodium chloride, and I made sure that I have the right patient, the right dose, the right time, the right medication, and the right patient, the right medication, the right route, the right dose, and the right time. Okay. So now I'm going to prime my tubing. I'm going to make sure that my roller clamp is locked. Okay, I'm going to hang my bag. Actually, I'm going to take off the blue bottom. Well, not touching it because it's sterile. Okay, I'm going to insert my spike, not touching it to maintain sterility. I'm going to hang my bag. Okay, with roller clamp locked, I'm going to squeeze it to about halfway there, to half full. Okay, now I'm going to slowly release my roller clamp to allow the solution to go through the tubing, making sure that I have all my bubbles out of my tubing. Okay. Okay, then now that my bubbles are out, I'm going to close the roller clamp. I'm going to hang that for later. Now I'm going to get my equipment ready. I'm going to just clean up a little bit. I'm going to get my tape ready. So I have that. Now I'm going to have my tourniquet. Okay, there's this. Okay, so now that I have primed my tubing, I need to prime my extension tubing. So I'm going to open this. I'm going to take it out. I'm going to unscrew the cap off of this. It is, I'm going to put my blunt tip into that end. I'm going to put a little bit in there, okay? And so now that that's primed, I'm going to leave this right there. Oops. I'm going to put this in here, and I'm going to wait for that to be ready. Okay, so now I'm going to apply my tourniquet. First, I'm going to assess the vein that I'm going to use, okay, and then I'm going to get an alcohol swab. I'm going to clean the site and allow that to dry while I apply the tourniquet. Okay, now that that's applied, I'm going to put on my gloves. I'm going to go ahead and loosen up my cannula. Okay, so at this point, the hand is, the area that I cleaned is dry now, so I'm able to start my procedure. Not procedure, I'm going to start my IV. So now I'm going to get my cannula. I'm going to hold the patient over the knuckles downwards, making sure that I have my cannula my bevel is up. Okay, I'm going to go in until I see some flashback. Okay, I see some flashback, so I'm going to go in about 1 millimeter. Okay, and then now that it is in, I can take my hand off of this, and I'm going to, while I retract the needle, I'm going to push the cannula into the patient's hand. Okay, I'm going to occlude the vein. I'm going to put this in the sharps box. Okay, now that I'm occluding the vein, I'm going to attach. I'm going to take off my cap of my extension, and I'm going to attach this. I'm going to keep it occluded with my middle finger, grab with these 2 fingers, and I'm going to attach my extension. Okay, I'm going to flush it a little bit to make sure that we're in the right spot. Okay, I don't see any edema or swelling or any irritation, so that's good. Now I'm going to remove my tourniquet, and I'm now going to get a piece of tape and just tape it into place. Okay, we're going to tape it into place for a little bit. Now I can remove my syringe. I'm going to add my alligator into this. Okay, I'm going to clamp this. Okay, and now I'm going to tape up my. I'm going to secure the IV. I'm going to get my gauze. And I'm going to gently, making sure that I don't break the cannula. I'm going to insert it right there. Okay, and now I'm going to, I would do the Chevron taping, but for time purposes I'm not going to. And then I'm going to put on my tegaderm. I'm going to initial date and time when I'm putting on the tegaderm. Making sure I'm being very careful with it. Okay. And I'm going to peel. Okay, I'm going to take off my initials, date and time. I'm going to put that to the side so the next nurse will know. Okay, now that I've completed that, I'm now ready to connect to my IV. And I'm going to take this down. I'm going to unscrew this, which is sterile. I'm going to insert it into my alligator clamp, and I'm going to screw it together in a screw-like motion. And then I'm going to release my roller clamp. Slowly allowing the drops to come. Okay, and now I'm going to tape the IV to the patient. so. And that's the insertion. And now I'm going to discontinue. I'm going to discontinue the IV. So if I was discontinuing it, I would clamp my roller clamp. So clamp that. I would remove my tape. I could remove the extension of this. So now I'm done with that. I'm going to remove my tape. Remove my tape. I'm going to remove my tegaderm. I'm going to remove this tape. I'm going to remove the cannula from the patient. Okay, and I'm noting that the cannula is intact. So nothing is left in the patient, which is good. Okay, and then I'm going to throw all that away. And going to take my gloves off and clean up my stuff. And